I'm Dr. Kevin Plancher, a board-certified orthopedic sports medicine specialist. I've had the honor of treating patients for over 20 years. It's true. It's exciting that kids can go out and have a lifestyle of running, biking, and swimming. But we still have to be cautious because these are children. This is not an adult. There are growth plates, and we don't know the long-term effects of some of this under the age of 7. We don't know results for less than 7 years of age. We're just being careful that it shouldn't be as competitive as an adult triathlete.
So you could be 6,
fun.
just make it fun.
Make it fun so they're really getting out there and enjoying themselves, so that we watch that we don't have injuries. We don't know these long-term effects. They're out doing the sport. There's nothing better. Our First Lady and the President has said we need personal fitness.
Yeah.
This is the beginning of it, but we have to be cautious because every parent believes their son or daughter is going to be the next athlete of the century. And we have to remember, we don't want everyone having an artificial knee at age 45. We just don't know.
Bingo.
When looking at a CAT scan, you want to see if there's a break in the skull.
Dr. Kevin Plancher, team physician for the U.S. ski and snowboard team, conducts a simple 20-second test on athletes immediately following a head injury.
If they have any signs of, for instance, a headache, if their eyes are floating and you can't track with the eyes, these are really big issues.
In some cases, Dr. Plancher believes one concussion may be one too many, especially for children.
Kids, younger kids, as their brain is developing, are damaged more by getting hit earlier. There seems to be some appearance of dementia now early on that appears to be associated with concussion.
Dr. Plancher is an orthopedic surgeon and an expert in this area and many others. So describe to us when you would think a patient with back pain would be a candidate for surgery.
So hopefully Elisa has tried some great physical therapy. It's important. That's great. It's important to get your stomach strong, which can support your back, get the hamstrings to stretch out. You might try some anti-inflammatories as well, and some muscle relaxants, or even some patches, which you can place on the lower part of your back as you have that pain that occurs. But it's about quality of life, and when that time comes that you can't do the things you want to do, you have to consider surgical intervention.
The big question I think a lot of folks at home have is, when do I know that my pain is severe enough that it warrants surgery? There's some telltale signs.
So as Elisa probably found out, when unfortunately the pain isn't in the lower part of your back, but now it goes down the leg and below the knee and into the foot with some numbness and tingling or weakness, it's time to consider sometimes surgical intervention. And I'm really excited to tell you there's some great new advances on the horizon with robotic medicine, with minimally invasive surgery, with the bloodless surgery. You, in fact, can get back to doing the things you want to do almost immediately, and you'd be pretty satisfied.
Thank you very much, Elisa.
Thank you.
Appreciate it.
Women are more narrow through that area. And by being more narrow, sometimes, but not always, we would have to place a prosthesis or the artificial joint into the knee, and there'd be a little overhang.
But what will the better fit of the Gender Solutions knee do for Campana and future patients?
Hopefully they'll have less pain because we won't be expanding the knee, and also they'll have a quicker recovery in getting up.
Let's see, Campana's getting up right now.
Heel toe?
Yes, it is.
Her first time without a walker since surgery at Stamford Hospital.
Hey,
Not bad.
not bad. I can't believe this.
She not only will foxtrot, but she'll be able to do anything she wants probably in 3 months.
Wow. That did go well.
One of the things that I see the most of in my office are patients with shoulder pain. They've been in the gym and they try to do exercises that hurt their rotator cuff or the muscles around the shoulder. Frank is doing military presses day in and day out. That's why he's jacked. Not too wise to do it, but I'll give you a little hint. If you bring the elbows in and you do it narrow, you might get away with it. But instead, why not try something different? Keep everything down below the level of your shoulder. That's the way to stay out of trouble. We're here in the spinning room. I'd like to give you a quick tip on how to stay safe when spinning. Remember, ask your instructor the first time to show you how to set up the bike. Get the right bike height. Make sure your feet are in a good position. Make sure your toes aren't pointed in. If you do that, you'll have a tendency when getting tired that your knees will get stuck in, and you're going to get really tired and you're going to have hip pain. That way, You won't get hurt. Being a team physician is great. It's a lot of fun. It makes it all worthwhile. Been doing it now for 20 years. Once you